Hi friends, this is Narendra from Naren System Talk. Today I am going to talk about a very important, pertinent topic, pertinent to all of us, which is concerning us, our day to day life, and also our quality of life, how it is going to be, and what can government do. This is related to government also, what government has been doing. It is about healthcare in India and how it stacks up against the rest of the world, including the developed world. So, India, which is aiming to be a developed country by 2047, the 100 years of independence, should focus mainly one of the critical areas is healthcare, because healthcare provides crucial, it is very crucial to the well-being of individuals, which will in turn create productivity for government and for people themselves and their family. So this will be very it's an investment by government. If you look at it as an investment, it has a good returns for the country, and for the individuals their quality of life will be better served. So where is India there? So India has been lagging behind in this sector. Some of the stats which I see are very depressing, so to say. United States, although albeit it quality of health is relatively less compared to other OECD countries, that is highly developed countries, it spends around 16% of its GDP, or nearly 1 trillion. Japan around 8 to more than 8.5% of its GDP, whereas India just has 2.1% of its GDP as the health, as it allocates for healthcare, which ranks as 77th or among 190 countries. If you look at the per capita expenditure, there also it is 78. It is like one of the lowest per capita for health expenditure. So these are some of the points which I want to highlight before going more into this topic. Where is India? India is a multiplayer. India has a multiplayer insurer system. It has an uneven distribution of healthcare. In some of the centers, highly developed cosmopolitan centers, it has a very good healthcare system, which is albeit very costly and affordable only to the rich, upper class, and super rich, and which when concerned to the middle class, they are squeezed, and the poor class is also finding it very difficult, despite under PMJ, Pradhan Mantri Jan Arogya Yojana, 8,000 crore rupees has been invested in this program, and more than 500 million, that is approximately 50 crore people are enrolled in this. It is one of the biggest program in the world in terms of healthcare. That's a good initiative, but the scope of this initiative is not in a way which is distributed in a right manner, and they can enhance the scope of this what you call as PMJ, so that low middle class, and this was based on the 2011 economic survey of socio-economic indicators. As per that, they have enrolled this, and middle class can equally benefit if they make a customized program which is inclusive of, which is included in this program as well, or you can make a different program altogether for middle class as well who are suffering. For example, if I want to say, outpatient procedures which are costly. A CT scan costs around somewhere from 7,000 to 11,000 rupees, which is highly expensive in terms of middle class people. And an MRI. These are all MRI. These are all very expensive, and a PET scan in case of cancer. If you want to detect some tumor, these cost very high, around 23,000 or something. It depends. It ranges from center to center. So these are not covered as inpatients. These are outpatient procedures which will diagnose and tell whether what is the stage of disease, what is the disease, or if at all there is a disease. So this is a prevention mostly in some of the countries. Let's say South Korea. We'll take the example of colorectal cancer. South Korea has one of the highest survival rate anywhere in the world, around 77.5% survival rate. So compared to that, Britain has around 55, US has around 62. Same with cervical cancer. So all this makes all the more there is a need for a comprehensive capping for all this. So the Indian government can take example of South Korea and Japan. Japan, I need to explain that Japan has a national insurance system, national health insurance, which by law every citizen has to avail one way or the other. There is non-profit organization, some insurance, some private players also. So they need to opt, and 70% to 30% is the ratio. 70% government will provide you the comprehensive insurance, healthcare. 30% you need to pay out of your pocket, or you have to take responsibility for that. That 30% is also divided among the socio-economic strata, and various geographical consideration is taken into the point, and thereby there is a 10, 20, 30 slab there, 30% being the highest income group where you can shell out from your pocket. And remember, all these medical tests and other procedure which I just explained is being subsidized by the government. Thereby there is also some economic problem. There was a shortage of money, and there was some co-opt payment was done. But initially, basically, Japanese government puts a cap on all the what you call the procedure, outpatient procedure, and critical care. Some of the surgeries, they have some caps on the higher cap of they put the cap for the high price. The pricing will be capped to certain level. So having said so, if you take an example, a neck MRI in US costs around $1,200. Average you can take, but in Japan it takes around $100. So this is what is the difference. So even US, where it is said to be an affluent country, has a very costly US is the only country in the highly developed country, OECD countries, where you don't have a universal healthcare system. This has been lamented by various legislators, their senators, they have lawmakers. They have been scrambling to bring about what they call the Affordable Care Act of 2010, also known as Obamacare previously. So that is inconclusive, and there are some part of it which is the by law which is not to be amended. There is a there is a discussion going among the Republican and Democratic Party there, how to make it more affordable, more viable. Having us putting aside, coming back to India. So India has one of the highest infant mortality still, despite being newly industrializing country with rapid growth. It has 30.7 or some odd child under 5 dying mortality per thousand. So this is the rate. If you compare that with say China with similar population, they have 7.23 odd per thousand. So this is the lacuna, this is the deficiency I can call. And Indians have malnourishment, nutrients are not sufficient enough in rural areas, and rural geography of India is much larger than the urban. In fact, it is shrinking anyway due to rapid urbanization, but the landscape is changing, albeit still rural population is more, and the availability and basic amenities of this primary, secondary and tertiary medical care is not available in these places, even though under Ayushman Bharat aka PMJ, you have some improvements, you have some kind of a reprieve, but yet it has to reach more. The penetration level is very low. Say for 1,000 people, the hospital beds in India is around 0.54, whereas in Korea, South Korea or Taiwan, it is around 18 per thousand. So this is the disparity. The disparity is also because of population, but also because the general practitioners, the allopathic GP, that is doctors, there are around 2 million people or more, but they are unevenly distributed. They cater to unevenly. 28% of the population is getting more than what the 73% is not getting in India. This 72 or 73% is distributed among semi-urban and rural and most underdeveloped regions of this country. So only 28% is getting full access. I mean, the doctors are no less, but yet around 2 million people are practicing allopathic, as they say. By 2014, it was the data. It might be more today, but even then, you see this. So, as I said, India under the report of disease burden index report, it ranks very low in accessibility. The parameters are accessibility, quality, and infrastructure. So India is very low overall. It is 147th among 191 nations. So the survival rate of the diseases are also very low compared to what South Korea is there. I told that colorectal cancer. The colorectal cancer is 77 point some 25%, but you say in US itself it is 62%, because South Korea has a comprehensive prevention care, primary, and they have a very cheap what do you call this diagnostic and other procedures which are done initially, which are very reasonable and very much affordable. It is subsidized again, and again they also have single payment system, universal care and universal health care, and they have this treatment before itself. They can do a screening. So screening is important for everybody, whether it is for cancer, to diabetes, to thyroid problems, and screening and blood work is very important. So this screening costs much in India. It is out of pocket whereas in Korea or Japan, it is highly subsidized. So that is the problem here. Whereas in US again, you have multiple player, mostly private players are there, and under Affordable Care Act there are some programs. Again, it is separately there, Medicaid and Medicare, Mediclaim. That is also one of the part, but the treatment by private insurers are very high, and the premium is very high out of pocket, but the infrastructure is world class in United States, where you have Mayo Clinic, and you have Cleveland Institute and Texas Institute, which are all very good in cancer and other related problem. They are among the top 10 in the world, and they have infrastructure which is fine with diagnostics. Everything is good, and they have good innovative system. But the problem is of cost and insurance. So United States is the only developed country whose cost and who is not coming under the universal healthcare system. Whereas most of the other developed country, say for England, they have a national health service. There is comprehensive payment by through tax funding, through taxation of employer and other taxes. They pool it, and from general practitioner to the uh, last emergency level, from primary to tertiary care, they have fully covered, and you are not made to worry about any other problems. That is the point in NHS. They have very good comprehensive system. At the same time, they have a shortfall of staff and other issues. That's a different matter, but yet they are covered under single payment system. There are single payment and co-payment. Two types of this one payment systems: single payment, multiple players, and two players. In Germany, you have two-player system. Two player system, that is one national health, that is public funded, and another one is private insurance. Each employees can opt as per their income level and age. Younger people tend to go into the private, and some of the lower and elderly people who are there, they prefer, because they cannot come back to, once they opt the private player, they cannot come back to the public funded insurance. So they opt for the public funding. So like this, there are various kinds of universal healthcare system. One of the best is Taiwan. They have preventive care. They showed it in COVID time also, and other things being, they are ranked in the global CEO health index. They are ranked top. South Korea, Taiwan. South Korea is something like 77 or 78, and Taiwan is 77. So they all come under this high ranking in the index of healthcare system, universal healthcare system. Whereas a developed country and so-called superpower, United States, is nowhere to be seen. It comes below 11th in these rankings in every parameter, accessibility, everything. Low strata and color is a determination factor in US, whereas in India it is rural, urban, rich, middle class divide. Rich, middle class, and poor divide. These are the differences. Anyway, the same. It is the same in US and India. There are multiple players, but the thing is, there is a certain amount of more accessibility to healthcare system and world class infrastructure, which India lacks. Which India is having a kind of a disparity in urban areas and in semi-urban, rural. Each kind they are having each kind of setup, which actually is very. It is a disparity factor that is playing into it. The rural population absolutely finding it very hard because, as I said, only 28% is serving to the vast majority of only urban population. The rural, that is about 72, rural semi-urban, 72 are left high and dry. So there is uh, many hospitals to be made and built. You have to incentivize the uh, hospitals, both private and public, doctors to go to rural and serve there, and you have to build more beds per 1,000 persons in entire nation without disparity, and you have to enhance the scope of this PMJ, that is the health scheme or Modi Care, whatever you call it. That you have to increase the scope to middle income group, and you can, like NHS in England or in Japan or South Korea, you can opt for a universal comprehensive kind of a um, payment system, insurance payment system, and healthcare payment system, which will make the life of patient easy, so that they can go for even preventive screening as well as the treatments which are costly. You have to cap certain very necessary, very important and critical tests and procedures, like cardiovascular procedures and cerebral brain surgery and certain cancers which are very required, and also the transplants, kidney transplant and heart transplant. These kind of high highly cost high cost procedures should be inpatient procedures should be having certain price cap according to the income levels. And that is why I'm telling you can increase the scope of the PMJ or Pradhan Mantri Jan Arogya Yojana. That is what I can suggest to that. One, you can cap the prices of procedure, outpatient procedure, just cap the price, because each player is pricing as per his whims and wishes. That is what it is. In government, it is cheap, but middle class and lower middle class, they are not going here to the public health centers because it is fully crowded and underfunded, and there is no advanced treatment facilities in those certain public health centers, especially in rural and semi-urban. Even in urban, you can find this disparity to certain extent. Say, for example, you will not have the same equipment, say, as Apollo to a government funded hospitals, government hospitals. So there are certain very famous government hospital like Nimans. They are absolutely fine, brilliant. But the other, again, the downside is, because it is cheaper, the crowd there is so much that people cannot, if it is under emergency, they cannot attend. So the doctors per patient is also very less. As I told, a doctor per patient is below 1 per 1,000 person, whereas in Cuba it is 8. So you can see the disparity. In US it is 2.6. China it is 2.6. US it is around the same time, same rate, 3 or something. So this is very low level of per 1,000 physicians you are getting. This you have to give a solution to, because doctors should be evenly distributed, and you can get the medical profession and induce them to practice more medical profession in India. It should be given more of a incentivization, because most people are thinking of AI and they are going to that technology or engineering kind. It will be vastly skewed over there. The disparity between the courses also is the reason, because most people want to go into particular sector. So what I'm thinking is you can bring in all the expertise, you can incentivize these doctors, you can give a good pay package, whether it is government or anyway. Private players are having hefty fees and they will anyway pay the doctors. But what you need to do is encourage private players also to set up some of their units in rural areas in a smaller way, which has some basic facilities and very critical procedures are done, or some critical what you can say is first hand tests, which are CT scans and MRIs, these kind of outpatient procedures to screening is done, so that if they find something they can go to the city, or they are given a direction to go to some bigger hospitals. So screening facilities is must in villages. So when contagious virus like COVID was there, India had to suffer a lot. So India did have low percentage wise, but overall India's death was high and the mortality rate was high because the hospitals were unequipped during that time. So India's bed capacity should be increased, prices should be capped, and one a kind of a scope, though it is a multiplayer system where you have multiple players like government funding and private insurer and co-payments, these kind of multiple system India is having. uh, Government initiative is the best. You have to enhance the scope to middle income, somewhat not exactly like NHS or NHI of Japan, but to an extent you have to cover a larger population, around say 800 million. Now you are having 500 million, nearly 1 billion you can cover, 1 billion Indians you can cover under a comprehensive universal health care. India has to bring it. So this, if they bring this, then the health care will be better served, and the rural areas, if you incentivize doctors to practice and give a lot of what do you call remuneration and their pay scale, they'll definitely go there. You have to incentivize them. You have to give them the perks which is needed for them. So that, and building more hospitals around the area in a district headquarters, wherein it caters to all the rural areas, or some building some branches of after that building a bigger say aims comes to uh, Mandya, or say Bijapur, or Gulbarga in Karnataka. If it is in Gulbarga city, then there should be some of the its branches, like some of the screening centers around those villages. Then you can have the comprehensive uh, penetration inside the villages and rural areas. I'm giving example. Anywhere in Uttar Pradesh or anywhere in very remote areas, you can build a screening center of diseases along with hospital in a nearby district headquarters. And some government hospitals can also be uh, built with you can implement your program of PMJ, that can be done, Ayushman Bharat, that is. So these are the solutions which I can give. And lastly, being a developing and going rapidly towards industrialization, India needs to innovate, do R&D, and build a world-class infrastructure for medical sciences, including the hospital setup, the screening setup. That's what I'm telling in a comprehensive manner, all round, and the payment and finance part of it. This is what is a comprehensive universal healthcare, along with hospital and R&D and medical centers across India with no disparity between the regional, in demographic and geographic divisions or disparities. So India has been very successful in eradicating polio, which is a commendable job, but it has to take care of its 1.4 billion population. So out of which 1 billion is or more is comprehensively should be covered. India should formulate a universal healthcare system on par with South Korea, where you can do before prevention is better than cure. So prevention made South Korea number one survival rate in cervical cancer as well as colorectal cancer, and some other countries which are longevity survival rate, long survival rate or long lifespan countries are Japan. Average age is more than 80. So you can just emulate or take inspiration from these countries. They may be small, but yet they can be an inspiration, and you can customize for your own. As per that, you take inspiration from those systems, and you can build a customization of healthcare as per your own capacity, because you cannot Taiwan cannot be compared to India. India is 1.4 billion, and there are vast poverty and richness and middle class. These are very despairing, many disparities. One of the most economically unequal societies in the world, similar to United States, where around 50% of the wealth is in top 2%'s hand. More than 50% of the wealth. That is a similar case in India. So these can be addressed by government as per their income and the census they have taken, the incomes, socio-economic strata. So these can cover it. So as I said, Japan covers 90% of reimbursement. If that 30% cap, it goes beyond the expenses. For example, a CT scan, if it is more costly in a more expensive hospital, if you are paying, so 90% of that, what is the bracket you're coming, that is 30% which you are paying out of hand, 90% of it is paid by the government, reimbursed. So in such scenario, India should have a comprehensive healthcare system. So being 147th in accessibility is not good. Being 77th in percentage to GDP spending, 2.1% is very meager. India should spend at least 5%, 5 to 6%, whereas Japan is spending 8, United States 16, leave it. Other countries are spending around 6 to 7, 5 to 6%. So you have to increase your percentage to GDP. That is my humble suggestion. With this, I hope you can take my suggestion, and it will be helpful for all the people. Please subscribe to my channel, and just visit PMJ portal once and see the eligibility, and you can also see various other programs. Some of the Indian players in insurance is National Health Insurance and Oriental Insurance, and others who are there is United India Insurance are also there, and private insurance there are many. After 1991 Deregulation Act, IRDA, Insurance Regulatory Act, that is IRDA, has been open to the market, and many players have emerged. So this has led to the intense competition. You have various policies. They may be cheap or they may be costly as per the company, how they are formulating it. But when government comes into play, there'll be more competition to get things cheaper. I am very sure. So, the options will be more for the citizens of this country for insurance, and the capping on the price of the procedures. You just This is my suggestion to the government on behalf of all of us. This is very helpful. This will be very helpful. In my case, also, I spent many lakhs out of the pocket, few lakhs, despite having some health issues. So, I myself have experienced this. Because of my experience, I am telling, please, government, state, and central government should take a look into this. Staying with United States, it reminds that let me remind you that one of the highly developed countries, it is the superpower to remind. It has some of the highest cancer rates, which includes colorectal cancer and stomach cancer. These are lifestyle diseases due to the consumption of highly processed foods, which are available all through Western world. Some of the diseases in lower uh, income countries or newly industrializing countries like India, there is some many areas of poor sanitation. You have infectious diseases like malaria and elephantiasis and some kind of dengue, tropical diseases like dengue. These are the common diseases found in India, and also urban centers are on par with. In India, urban centers are on par with the developed world. They have the same uh, problems like obesity, which is prevalent in United States, and colorectal cancer and stomach cancer, etc. So Crohn's, colitis, these are all kind of lifestyle related, mostly diseases due to the consumption of the so-called junk food. So hence we have to move away from that thing, and prescription drugs are very costly in United States and India. I recommend once again that AIMS, which is forefront in many pioneering in many areas in medical field like stem cell therapy, and it was the first to perform the heart transplant in 1994. So such AIMS institute is proposed in Madurai and some other places, 24 other places if I am correct. As I told, each district should have a mini AIMS and kind of a setup and infrastructure. Thereby, the villages, headquarters and villages will be connected with that. Villages should have some basic screening facilities, whereby if it is a tertiary or emergency, you can uh, send those cases, or those cases can be attended by the AIMS in the headquarters, say district headquarters. So this is some of my suggestions. So with this, I'll take a bow. Seeing you until next time. Bye.